The goal of this video lecture is to discuss a cognitive behavioral perspective explaining the symptoms of obsessive-compulsive disorder. So this perspective is going to integrate our cognitive models, where we're emphasizing the role of people's beliefs and how they interpret different situations, with our behaviorist perspective, where we're emphasizing the role of learning and classical and operant conditioning. So from our cognitive behavioral approach, our important starting point is what we learned about the prevalence of obsessions in the general population. So what we learned about obsessions is that obsessions are actually very common. Most people experience obsessive thoughts. However, most people do not go on to develop obsessive-compulsive disorder. So this cognitive behavioral approach can help us explain the transition from having these obsessive thoughts and occasionally engaging in these compulsive behaviors that we know characterizes the general population, and how these experiences can change over time to manifest in the symptoms of obsessive-compulsive disorder, which affects about 1% of the population in any given year. So the first element of this theoretical approach is going to be using our cognitive approach to explain why people develop problems related to obsessive thoughts. So from a cognitive perspective, what drives the frequency and distress that we associate with obsessions in obsessive-compulsive disorder is that people make maladaptive interpretations of their obsessions. So we know that most people have obsessive thoughts, and for most people they have the thought, they experience it, and then the thought goes away. But some individuals interpret these thoughts to mean other things. So for example, if they have an intrusive thought about harming someone, they might worry that it means that they are a bad person or that they're actually going to harm someone. If they have an intrusive thought that they have left the stove on, they might interpret it as evidence that they actually have done so. So individuals who go on to develop obsessive-compulsive disorder often interpret these very normal obsessive thoughts in more maladaptive or systematically biased ways. Then we can combine this with the behavioral component, which can help explain the development of compulsive behaviors. So when these obsessive thoughts are creating anxiety, compulsive behaviors that reduce that anxiety are then negatively reinforced by a reduction in anxiety. So for example, if someone has an obsessive thought that they have left the stove on, and this is causing distress, and they think that it is evidence that they've actually left the stove on, they might engage in compulsive checking behaviors. Short term, this checking behavior is going to reduce their anxiety. But paradoxically, it is also going to increase the frequency of those obsessive intrusive thoughts and increase the likelihood that they're going to continue engaging in that compulsive behavior. So in the case of obsessive-compulsive disorder, so you can see this process outlined in this diagram. And this process begins with the presence of an obsessive thought. It might be a thought, an image, or an impulse. And we know that most individuals have these obsessive thoughts. But in the case of someone who is at risk for obsessive-compulsive disorder, they may interpret this thought to mean something about them. So maybe having this thought means that they are the kind of person who might engage in that behavior. Maybe it means something bad about them. And then this interpretation can lead them to experience distress. So they may be worried about the consequences of this for their self-concept, or they may be worried about actually engaging in some of the behaviors that they are worried about. So some of the consequences of experiencing this distress and fear may be changes in cognition. So one thing is that they may try to avoid having these obsessive thoughts because they cause distress. And paradoxically, attempting to avoid thinking about something can actually increase the frequency of that thought. So I'm going to ask you to do a quick thought experiment. for the next 10 seconds, I'm going to ask you not to think about a polar bear. Most of you will find that over the last 10 seconds, you thought about a polar bear at least once. You probably would not have thought about a polar bear at all if I hadn't asked you not to do so. So when individuals respond to the distress caused by their obsessive thoughts by trying to avoid these obsessive thoughts, they can actually increase the frequency with which they're experiencing these obsessive and intrusive thoughts. Another way that people might respond to these obsessive thoughts is by engaging in compulsive behaviors. So, for example, engaging in checking behaviors or engaging in avoidance behaviors, trying to avoid situations that lead to their obsessive thoughts. But as we know from our discussion of anxiety disorders and post-traumatic stress disorder, these behaviors are then going to be reinforced. So there's going to be negative reinforcement by a reduction in anxiety that paradoxically is going to increase the frequency of those compulsive behaviors. So as a whole, this cognitive behavioral approach can help integrate the interpretations that people make when they experience an obsessive thought and the kinds of behaviors that they engage in to manage this anxiety to help explain why most of the population experiences obsessive thoughts but does not develop OCD, in comparison to some individuals who experience obsessive thoughts, which we know are common and normative, but the way in which they interpret and respond to these thoughts can then escalate into frequent obsessions and compulsions that are distressing and lead to impairments in functioning that characterize obsessive compulsive disorder.